Good evening and thanks for joining us tonight for 23 ABC News at 6. I'm Jessica Harrington. Tonight's top stories. Local health officials releasing new numbers for COVID-19. We'll tell you how many cases Kern County Public Health is reporting now. And states around the country continue to deal with the impact of COVID-19, while New York's governor feels that they have gotten through the worst part of the pandemic in New York City. 23 ABC News at 6 starts right now.
Live from downtown Bakersfield, 23 ABC News at 6 starts now.
Good evening. While some doctors nationwide are turning to hydroxychloroquine to help treat patients with COVID-19, this is also the same drug used to treat those suffering with lupus and arthritis. 23 ABC's Kylie Walker spoke to local pharmacies who say the demand for the medication is causing some patients to wait for months.
Have you tried to get it?
Yes, every day. My wholesaler has zero in stock.
And this seems to be a pattern among other pharmacies.
I call every day, but the wholesalers don't have it.
And some pharmacies are on back order for the next 3 months.
There's no supply for the hydroxychloroquine. Like 2 months ago, the wholesaler did not supply, and we tried to get from different wholesalers, they could not get it too.
And many pharmacists say hoarding could be to blame.
I got a lot of prescriptions from people who don't have lupus, and they just want the medication in case they get the virus.
You know, they're hoarding toilet paper, so now they want to try to hoard these meds, even though they don't have COVID-19.
And for the few pharmacies that still have hydroxychloroquine, they only have what is left of what they ordered prior to the pandemic. They will be saving those specifically for lupus patients with verifiable documentation.
We have to ration it and give it to people who really need it.
And the pharmacists tell me the remainder of their supply is running extremely low.
I basically only have like 100 tablets, and my lupus patients get 60 a month. So I don't even have enough to fill, 2 prescriptions.
I have 3 bottles left. Per month, that would treat 4, almost 5 patients.
That was Kylie Walker reporting. For those suffering with lupus, pharmacies say to call your doctor to discuss different medications that can be used in the meantime. They also say they will only give the remainder of their medication to their existing patients with lupus. Kern County Public Health reporting more cases, but also reporting more test results have come back negative for COVID-19. Public Health now says 454 COVID-19 cases have been reported total here. 446 are residents, 8 are non-residents. The death toll is still at 3. However, there are now more test results that have come back negative. Nearly 3,800 have returned negative so far. Officials also saying they've administered more than 6,900 tests. 2,600 tests are still pending. An employee at the Target distribution center in Shafter has tested positive for COVID-19, according to management. At this time, it's unclear whether anyone else in the center has been exposed. Target released the following statement saying, quote, "We've communicated directly with the impacted team member who is in quarantine and following all health department guidelines and will pay them while they're on leave." They added, "We've notified the entire distribution center team and provided them with the appropriate CDC guidance. We'll continue to first and foremost take care of our team and guests." California Attorney General Javier Becerra has sent a letter to the acting Secretary of Homeland Security and the Trump administration. He's calling for action to minimize the spread of COVID-19 at immigrant detention facilities. The letter was a response to the Department of Justice's review of detention facilities. The Attorney General calls on Homeland Security to consider alternatives to protect the health and well-being of individuals in civil immigration detention. Becerra says communities are facing an unprecedented threat and says all of us must take steps to minimize the spread of the virus. The letter calls for these steps to be taken from Homeland Security. 1, limit the transfer or transport of detainees and halt the introduction of new detainees to immigration detention facilities. Also, obtain COVID-19 test kits and conduct comprehensive testing of staff and detainees. Well, some good news today. Some Americans report they've started receiving their direct relief payments as New York State shows signs it is flattening the curve. But the coronavirus crisis remains far from over. ABC's Inez de la Cuerta has more from around the U.S.
Joseph.
Numbers that we have.
Today, New York's governor striking a hopeful note as key COVID-19 figures continue to indicate New York is flattening the curve.
I believe the worst is over if we continue to be smart.
Cuomo adding the challenge now lies in how the state will move to reopen. President Trump has indicated he'd like to reopen the economy by May. Today, the World Health Organization insisting restrictions must be lifted slowly and incrementally.
While COVID-19 accelerates very fast, it decelerates much more slowly. That means control measures must be lifted slowly and with control.
Over the weekend, the nation's top infectious disease expert telling CNN government inaction may have cost lives.
If you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. But what goes into those kinds of decisions is complicated.
Today, Dr. Fauci walking those comments back.
The first and only time that I went in and said we should do mitigation strongly, the response was, yes, we'll do it.
Around the nation, the pandemic is taking hold in new hotspots. The number of confirmed cases soaring by 21% in Massachusetts, while Pennsylvania expects a surge this week after more than 2,800 new cases were reported Saturday. And the Navy now revealing a sailor who tested positive for the virus on the USS Theodore Roosevelt has died. ABC's own George Stephanopoulos saying he's tested positive for the coronavirus, but with almost no symptoms.
I've never had a fever, never had chills, never had a headache, never had cough, never had shortness of breath. I'm feeling great.
The CDC says about 25% of infected people here in the U.S. are asymptomatic. Other countries have found that number could be as high as 50%. Inez de la Quatera, ABC News, Washington.
And we are going to see a beautiful week ahead. We are going to see temperatures up to 80 in Bakersfield. And we have a warming trend on the way, keeping us warm all the way through until next weekend. But let's take a look outside at your radar and satellite. We can see those clouds already moving out of the region, and we are fairly warm this evening at 72 degrees, a 2-degree increase than what we saw yesterday around this time. And we're going to continue to see those beautiful temperatures the rest of the week. But let's take a look at your weather headlines. We are tracking gusty winds in those mountain and desert areas. Up to 50 miles per hour are possible through this evening, and we do have a wind advisory, which I'll take a look at in just a second. But those dry and warm temperatures are making a comeback. We're going to see mid 70s to near 80s by midweek, but we are tracking the chance for some wet weather to make a return by the end of the week. We are tracking a very weak system moving in on Friday, but coming up in just a little bit, I will let you know exactly when that rain is expected to come.
Well, the coroner has identified the man who was killed in a shooting on Union Friday night. Officials say they responded to Union Avenue just before 11 Friday night in response to a single shot heard in the area. When they arrived on scene, they found a man identified as 44-year-old Brian Dante Dickerson suffering from a gunshot wound. He died at the scene due to his injuries. No one has been arrested in the shooting, but police are looking for 46-year-old John Glenn Hardison Jr. in connection to the shooting. He's described as a black man, about 5 feet 9 inches tall and weighing around 170 pounds. If you have any information on his whereabouts, you can call BPD at 327-7111. Meantime, the coroner has also identified the man who died in a traffic collision on Friday on Highway 99. Officials say it happened around 7 Friday morning on southbound 99, just north of Hosking Avenue. They say 36-year-old Vicente Arturo Rodriguez from Corcoran, for an unknown reason, drove his vehicle off the road and crashed into a tree. He was transported to Kern Medical, where he later died. The intersection of Fairfax Road and College is being rerouted due to a sinkhole in the road. Around 7 this morning, City Public Works was notified that there was a sinkhole at the intersection of Fairfax Road and College Avenue. Officials say the hole is about 12 feet in diameter and about 10 to 12 feet deep. They added that they are doing some excavation to try to figure out where the water is coming from that is leading to the sinkhole.
Just be safe driving through the intersection. We have a lot of traffic that's coming just to look at it. So please stay away if you can. Avoid the intersection. Otherwise, be cautious as you're going through the intersection.
Public Works says the intersection could be rerouted for the next couple days as they work to figure out what the true cause of the problem is and to get it repaired.